Dr. Napolitano, I would like to talk to you about, red eyes, burny eyes. I don't even know whether it's one and the same. And the stuff one can buy, and many people do buy, in the drugstore, just kind of like putting drops in it, doing things to do it. How much good is that? How much damage do they do, if at all? Anyway, tell us about what brings it about and what should be done.
Well, red eyes or burning eyes could be caused by several different things. I think in my office that the biggest culprit of red eyes is dry eyes. I see a lot of my patients, I would say 9 out of 10 of my patients have some form of dry eyes. And it's not uncommon because, in this day and age, if you do a lot of computer use, a lot of reading, chances are your eyes are going to be dry. Just because of the fact that as humans, when we do anything up close, we tend to stare. We don't blink as much. So over a long period of time, if you're using that computer all day long, 5-6 days a week, your eyes are going to become dry because you're decreasing that blink rate. Now, dry eyes could also cause blurry vision. Not only redness, could also cause blurry vision. A lot of my people that have dry eyes, they would say, after I read for like 20-25 minutes, I can see everything becomes blurry. That's because of the dryness, because the tear film in front of your eye that it's supposed to moisturize your eye, it's just not there. And dry eyes, many times it's very easy to treat just with like artificial tears, which you can buy over the counter. But you have to use them on a regular basis. If you use them once or twice, it's not going to do anything. It's going to make your eye feel better for 5-10 minutes, but it's really not going to get to the core of the problem. Another thing that dry eyes also causes besides the redness is the burning. And also, the number one complaint I would say is tearing. When I tell my patients, they come in, they say, my eyes tear a lot. And then at the end of the exam, I tell them, you have dry eyes. They look at me like I'm a crazy person. What are you talking about? I have dry eyes. And, I'm telling you, my eyes are tearing all the time. How can that be? Well, the thing is that when the eye becomes dry, it sends a message to the brain. It says, hey, I'm dry. I need more lubrication here. So the brain automatically starts to make more tears. More tears. But the eye, the front of the eye, it's a very small container. So when it starts to make all these new tears, they just run down your face. They have nowhere to go. They cannot drain, and they run down your face. That's a sign that the eye is dry. Another thing that could cause the redness of the eyes is allergies. Especially in the spring or the fall season, allergies is a big problem with the eye. A lot of people take, oral medication, over the counter for their allergies, and they think that also takes care of the eyes. Many times it does, but many times it doesn't. When we take a pill, by the time it reaches the eye, the effect is so diluted that most likely it's not going to take care of the eye problem. So we need something a little bit more topical to take care of the allergies in the eyes, and then we have certain things like people that use contact lens. If they overuse them, they definitely can have some irritation from the contact lens use, and a lot of my patients, they use those over the counter like Visine to remove the redness, and that's all it does. Those over the counter, that's all it does. They remove the redness, but they don't get to the core of the problem. So it's important, if you're not experiencing red eyes, go have the eyes checked, go have the eye exam, and, take the advice of the eye care doctor and see, what it tells you.
Right. So don't try to so to say, diagnose/medicate yourself because, especially in the eye, well, actually in the whole body. But
just like anything else.
Yeah, you have mentioned so many areas where the symptom getting blurry or whatever it might be is there with many deficiencies in the eyes. It could be just natural not seeing well. It could be this. It could be cataract. You really need to check it out. Otherwise, you just don't know how you're going to fix it. And I like
just like anything else.
Right. I've never heard that, but it makes a lot of sense. You said about you have dry eyes, but you have a lots of tears. Actually, the same is happening with lots of people who think that they have an acidic stomach and they have acid, and they take antacid when they really don't have enough acid. See, that's why it produces it. So if they actually would drink a couple of spoons of nice apple cider vinegar every day, they would actually be right away fine. It's kind of another way. So it's intriguing, obviously, and I mean, maybe the doctor will say, look, that's fine, and yeah, you take this and type drops, and you can get them over the counter. The doctor will say it anyway, whatever it is. He'll get you to the right area of it. If it's not a major problem and just some any day, everyday drops will do the trick, the doctor will tell you. If you need a little more, he'll tell you. So go to a doctor. Don't try to say this is normal and, oh, whatever, that's me. No, it's probably not. It probably can be cured, or I mean, at least slightly helped out.
Yeah, correct. It's not. Chances are, if it's a recurring problem, it's not normal. Even if it's mild to you, it's not normal. It's not supposed to happen. It needs to be addressed.
Right. Another thing, you said something about overusing the contact lenses. What did you mean by that? Meaning, are you not supposed to have them in all the time, or are you meaning people reusing them? You know, like those keep them in a week type of stuff. What are you referring to in that area?
I refer about both. The mostly common used contact lenses right now are either the 2-week disposable or the monthly disposable lens, meaning you keep them for 2 weeks. You take them out at night, but you keep them for 2 weeks and you throw them out, or for a month and you throw them out. A lot of patients, and I see it every single day, if it's a 2-week lens, they try to use it for 4 weeks. If it's a monthly lens, they try to use it for 2 months because pretty much they try to save money, which is great. But it's not healthy for the eyes. Also, wearing contact lenses 7 days a week, like I said before, I wear contact lenses. So contact lenses is a wonderful option we have. It's great. It's comfortable. It allows us to, not wear on glasses and still see clear, be pretty, all the nice things. But they cannot be used 7 days a week. It's still something. It's still a piece of plastic. As great as they are nowadays, it's still a piece of plastic that goes in your eye. It's not supposed to be there. And you cannot use it 7 days a week because the amount of oxygen supplied to the eye, no matter how good that contact lens is, it's not the same as not having a contact lens in the eye. So usually what I recommend my patient is 6 days a week should be the most. You have to allow your eyes at least 1 day a week where it's breathing on its own. Just let it recuperate, just relax, and try to just get more oxygen that has been deprived with the contact lens use. And definitely using contact lenses for more than recommended, yes, it saves you a few dollars here and there, but over the long period of time, it will give you eye problems. The eye is going to become so sensitive, so vulnerable to infections, irritation, allergies, all things that you do not want to have in your eyes. It's just simply not worth it. The reason that, we tell you it's a 2-week lens or it's a monthly lens, there is a reason for that. We just don't, out of the blue come up with saying, oh, this is a 2-week lens or it's a monthly. And there is a reason. After that 2 week or the month, the lens, the structure of the lens is just not the same. The oxygen supply is not the same.
Yeah, well, I guess it's like with everything else, you say 2 weeks, we, for some reason, wear it a day or two longer, we see no problem, we go, oh, why not longer? It's a little bit like, I eat a nice piece of camembert at night. I didn't really gain weight, so I eat it more often. 10 years later, you go, oops, something went wrong.
Correct.
Yeah. I understand. Well, all right. Thanks for shining some light on that situation.